there, my name's Dr. Amy Moore. I'm a vestibular physical therapist, which means I treat dizziness and balance problems for a living. You may know my friend Christine, who is That Dizzy Girl, here on TikTok and Instagram. Christine and I are starting a collaboration called The Dizzy Connection, where we share questions and information between clinicians and patients. For the first installment of this episode, I am going to be posing a question to Christine, from doctor to patient. Christine, what I want to know today is what are some things that are appropriate to say to someone who suffers with vertigo symptoms? And also, what are some things that are inappropriate?
Hi, I'm Christine, also known as That Dizzy Girl, diagnosed with triple PD and VITA board member. Thank you for your question, Dr. Moore. Here are some suggested things that you should and shouldn't say to someone dealing with chronic dizziness. The most important thing to remember is that having a vestibular disorder is an invisible illness, so we just want to be validated, seen, and heard. So here are some things you can say. I know you're doing all the right things. I can see how hard you're trying. You look great, but how are you feeling? It's okay if you have to cancel plans. I understand. How can I support you? Can I go pick up your meds? Or pick up groceries? Or do you want me to drive you to a doctor's appointment? Tell me more about your experience with chronic dizziness. And here are some things you shouldn't say. Please don't invalidate our experience by saying something like, well, at least it's not cancer, you know? Or something like, sometimes when I stand up too fast, I get dizzy too, so I totally understand. Please don't just ignore that it exists. It's there, it's real, and by not asking or talking or checking in on me doesn't change the fact that I have chronic dizziness. Well, you look great, so you must be doing better. Please don't provide unsolicited advice, like, my coworker went to this place where they put her on a table and then they tilted her head a bunch of different ways, and now she's totally fine. Have you tried that? Overall, it's really important to remember that every vestibular diagnosis is unique, and the treatment for every diagnosis is also going to be unique. Thank you for your question, Dr. Moore, and I will see you all next time on The Dizzy Connection.